Hi, this is Dr. Pepe. Welcome to 5-minute videos review of the NCE. Today we are in subcategory 2, intake assessment and diagnosis, and we are going to be covering assessing for trauma. So before we begin talking about assessing, you may encounter what in the field they call trauma-informed care. That just means that someone is informed of the trauma characteristics, behaviors in a multi-dimensional setting. So trauma-informed assessments is when the professional is identifying the needs in the services in order to meet the needs of the individuals. And a trauma assessment, or you may also hear trauma screening, that refers to a process that is focused on the inquiry in order to determine the individual's experiences in one or more traumatic events. And as the mental health professional, you are to determine the needs as well as a comprehensive trauma informed assessment with the ultimate goal of addressing the not just the behavior, but the trauma that is impacting the behavior. Trauma-informed mental health assessment refers to the process, so that includes things like interviews, standardized measures, behavior observations, and all of those are designed in order to gather information, to look at severity, look at timing, look at the nature, and in order to get a good grasp of the symptoms and the impairments that are going on. Also, clinicians with trauma assessments, they are to understand the history and how that developmentally impacts the social, the emotional, and the behavior domains of the client. And once that is understood, then that drives the treatment planning as well as the goal setting during the process. So all of this is interconnected, right? First, you want to use a multimodal means of assessment. You may do interviews, you may do standardized measures, you may do observations. Then you want to check for severity, you want to check for both functional impairment as well as behavior impairment. And that information will then drive you into conceptualizing, understanding, and ultimately into the treatment planning phase, as well as looking at goal setting, and most importantly, building that therapeutic rapport. So with any traumatic assessment, it's a complicated dynamic. You have to be very mindful of all the different factors that are going in, factors that are overt and invert, and you also have to be mindful of the traumatic response and how a client may respond um, to all the different stimuli that are happening. With a traumatic assessment, it's important to understand the notion of traumatic stress and how that impacts the view of the client, whether you're working with a child or an adult. So all of that really is to say that a trauma-informed mental health assessment is a comprehensive way of looking at a complex dynamic.